Hello everyone. Again, this is second half of the lab. We are discussing the muscles. So you see this beautiful image there. You have a lot of beautiful muscles here, as you can see. You have the trapezius muscle. Again, this is superficial. This side would be the right side, of course, anatomically, and this is an anatomical position. This would be the left side. The muscle located on the right side, this will be the superficial muscle, and on the left side will be the deep muscle. We're gonna take this first muscle, beautiful muscle here called deltoid muscle. Looks like delta, like triangle. Deltoid muscle. This is very important muscle, of course, especially for the athletes. If you strengthen this muscle, your shoulder should be good, especially the shoulder joint, one of the weakest, I think, joint in the body. And if you strengthen this muscle, you'll be able to keep your shoulder joint safe. Pectoralis major muscle, this beautiful muscle right here. Very important muscle too. And as we discussed before, pectoralis major, you expect there is another muscle will be minor, and this one will be right here. And the deep layer, this will be the pectoralis minor. Pectoralis, you remember, LIS. This is a pectoral girdle. So pectoralis muscle that cover the pectoral girdle. So we have one major here, and you have minor in the deep layer. Biceps brachii. Again, bi mean two, ceps mean head. So this will be the muscle with two heads. Muscle with two heads. Brachii mean in the brachium or the arm. Okay, because you have another biceps muscle called biceps femoris. This will be in your leg. We'll discuss it next week. Okay, and if you go a little bit down in the arm, so this is a biceps brachii right here. You go a little bit down, you're going to find those beautiful muscles in the forearm. One called Pronator Quadratus. This one called Pronator Quadratus. Pronator from pronation, muscle actually that flip your arm, make your palm face down and your back of your hand facing up. Pronation. Pronator, and this one of the muscle, actually the muscle action showed you the name of the muscle based on the muscle action. Okay, another nice muscle here called Brachioradialis. From the muscle itself, it coming from the brachium here, which is the arm. Go radialis mean muscle that cover the radius bone. So from the muscle itself, you can tell it come from the brachium, from your arm going towards your radius bone. Again, you add LIS, that's mean the muscle that cover this particular bone. And flexor, this is a muscle action. Carpi, this is will be the carpal bone or your wrist. Okay, carpi. So flexor, carpi, radialis, or carpi, whatever, however you want to pronounce it is okay with me, as far as you can answer in the exam. Flexor, carpi, or carpi radialis. Okay, so if you expect there is flexor, carpi, radialis, expect flexor, carpi, ulnaris will be on the other side. Okay, and the when you go to the muscle here and the abdomen over there, this is called external oblique muscle. External oblique. Oblique means the muscle fiber tilted like this. It's not straight. So if you have external oblique, based on the law we discussed before, anatomy law, you expect you're going to have internal oblique. Okay, and you have rectus abdominis. See this here, rectus abdominis. Rectus mean, see the muscle fiber goes straight up. Rectus. So rectus abdominis, the muscle fiber go up and it's in the abdomen, because we have another muscle in the leg called rectus femoris. That's in the femur. Okay, beautiful. So if you look at the other side, the deep area, you have external intercostalis. External will be external, this will be outside. Intercostalis, that's between the ribs. The translation English will be the muscle, the outside muscle between ribs. Intercostalis is, it's exactly like interstate parkway, right? Interstate parkway mean the highway between states. Intercostalis will be muscle that cover the between the ribs and it's outside. And we have mentioned before that Pectoralis minor, Pectoralis minor muscle, major here in the superficial layer. Pectoralis minor will be the one in the deep layer. And you have Serratus Anterior, Serratus Anterior muscle. Serratus Anterior, so you expect what? There is Serratus Posterior. We'll go and see like in the posterior view. And Serratus looks like the fan, you know, fan. Do you remember those old ladies that used in the past, in the 60s, used to hold their fan in their hand? Like very classy ladies. Of course, all of us miss them, classy ladies. Anyway, so this will be the Serratus Anterior. And this beautiful muscle here called Brachialis. Brachialis. So brachium, the arm, LIS, muscle that cover the arm. And remember, brachialis work as synergist in elbow flexion. Synergist mean co-pilot, or the muscle that help the prime mover or the agonist muscle to perform the action. We're just reviewing what we studied before, right? Supinator. Supinator, this actually the muscle that performs supination. Supination, you ask someone to give you something, you forward your hand to them. Can you give me a pen? Can you give me the dollar? Can you give me whatever? So this is the opposite of pronator. This pronator here, see, pronation, and this one supinator, perform the opposite. And flexor digitorum profundus. Translation in English, flexor, muscle that flexes the arm here. Digitorum, that flexes, the digit or your fingers. Profundus, it's big one or widely spread muscle, profundus. Here, flexor pollicis longus. Flexor pollicis longus. Pollicis in the name actually, the pollex. Okay, this is actually the name of your thumb. So flexor pollicis longus, muscle that bend your thumb and it's long. Okay, translation English, muscle that flexes your thumb and it's actually long muscle. Pollicis will mean the thumb, right? Pollex is the thumb. And when you study the lower limb, you have another muscle in the foot called flexor hallucis longus. That's mean the big toe in your foot. So pollex will be the thumb, hallux will be the big toe in your foot. Okay? Okay, just a little bit of origin and insertion. Okay, let's take the external intercostalis. The origin will be inferior border of superior rib, inferior border of superior rib, and the insertion will be superior border of inferior rib. Okay, and what the muscle action? Elevate ribs, which expands thoracic cavity during inspiration. So this muscle help with the inspiration or the breathing, and it's innervated by the intercostal nerves. Internal intercostalis will be the superior border of the inferior rib, and the insertion will be the inferior border of the superior rib. So you can actually do crossing here if you want to memorize them. Okay? And what the action? Depresses ribs, which compresses thoracic cavity during forced expiration. another breathing muscle. And again, it's innervated by the intercostal nerves. Diaphragm, very important, as you know, it's in the costal cartilages and ribs between 7 and 12, xiphoid process, and lumbar vertebrae. The insertion will be the central tendon of diaphragm, and of course the action will be flattens during contraction, which expand thoracic cavity and compresses abdominal viscera during inspiration. And it's actually innervated by the phrenic nerve. This is just example of the origin and insertion. Again, when you find yourself comfortable with the bone, reading origin and insertion, that means you study well. You really did a great job in studying the bone. Sorry, just okay. So this side would be the deep, and this side would be the superficial one. Okay, we're back again to the semispinalis capitis. Semi-spinalis capitis mean half. Spinalis, muscle that cover the spine. Capitis, first vertebra here, the atlas. Okay. Splenius capitis, see this one, the whole muscle. Okay. Splenius capitis, this half muscle, semispinalis capitis. This is the splenius capitis, the whole muscle. Okay. And we have remember the elevator. Remember, if you add E here, this will be elevator scapulae. That's mean muscle that elevate the scapula. The scapula is right here, as you can see. Okay, so this is actually the muscle that elevate the scapula. Pull it up. Okay. Now, those muscles attached to the scapula and to the spine, one called rhomboid minor. Rhomboid, this one called rhomboid minor. So when you have minor, what do you expect? Rhomboid major. Yeah, beautiful, excellent. Here, this is the rhomboid major. Okay. And we have the supraspinatus muscle. Supraspinatus, it's right here. Again, remember, this is the spine, the scapular spine. You have supraspinous fossa, infraspinous fossa, right? So the muscle that cover the supraspinous fossa called supraspinatus. Supraspinatus. When you have supraspinatus, you expect one infraspinatus right here. Muscle that cover the infraspinous fossa. Go back, review the bones, the scapula, okay, scapula. And you have the teres minor here, teres minor. Okay, let me change the color a little bit. Okay, you have the teres minor, it's right here. Okay, and this will be the teres major again. What's important about supraspinatus, infraspinatus, and teres minor, teres major? Okay, we're gonna come to this next slides. Okay, anyway, on the superficial area here, you're going to find the trapezius, which has this muscle called, it looks like trapezoid. This is one of those muscle you name based on the shape of the muscle. Okay, deltoid, the one we discussed, this is the inferior view, looks like delta. So this is actually two examples of the muscle. This one, the shape, this one, like you name the muscle based on the shape. This trapezoid, this is triangle or delta, deltoid. Okay, and again, infraspinatus, the beautiful infraspinatus here. Okay, and the teres minor right here, teres minor, and then the teres major, this beautiful muscle here, and this is the latissimus dorsi or dorsi, nice muscle cover 3/4 of the back, lower back. And this is something called thoracolumbar fascia. Thoracolumbar fascia. This actually the whitish sheet that cover the muscle. Thoracolumbar, that's mean coming from the thoracic. going to the lumbar vertebrae fascia. Okay, and this is posterior view of the triceps brachii. Tri mean three, ceps mean heads. So the muscle with the three heads, and it's actually in the arm, the posterior aspect of the arm. Okay, if you look here to this muscle, very important muscle called Erector Spinae, this group of muscle. This actually the muscle that makes you walk in 2 feet. Erector come from erection, so this makes you walk straight up into. Just to take some of the origin and insertion, we have Pectoralis Minor. Origin will be the sternal end of reps 3 and 5 to 5. The insertion will be the coracoid process of the scapula. Remember this nice process in the scapula. This is the scapula, for example. Looks like this, called coracoid process of the scapula. And the action will be pulls the scapula forward and downward, raises the ribs. Innervated by pectoral nerve. As I said, the innervation you will understand more when you study the nervous system at the next semester by 160. Okay, Serratus Anterior. Serratus Anterior, it's lateral surface of most reps, and medial border of the scapula will be the insertion, and it pulls the scapula anteriorly, protract the scapula. Okay, elevator scapulae or levator scapulae, this nice one, transverse process of cervical vertebrae C1 to C4, and insertion will be medial border of the scapula. Most of those muscles, as you can see here, will be in the medial border of the scapula. Okay, and it's elevate the scapula. Okay, this actually to show the rotator cuff muscle. This I mentioned in the previous slides. You have supraspinatus muscle here on top of the spinous process of the scapula, infraspinatus, and teres minor. This is called rotator cuff muscle, and there is always a nice question here. They give you the option which one is the rotator cuff, or all is the rotator cuff muscle except or but will be teres minor. Actually is not one of the rotator cuff. The fourth one will be the supraspinatus. Supraspinatus. I'm sorry, not supraspinatus. Subscapularis. I'm sorry, subscapularis. Subscapularis. Okay. So the fourth one will be subscapularis. So supraspinatus, infraspinatus, teres minor, and subscapularis. The one actually is not from the rotator cuff will be the teres major. Not. Okay. No problem. I hope so. And this is the subscapularis here in this image. This is actually one of the rotator cuff muscle. This is of course the humerus. This is a Kuraku Brachialis. See from this name, Kuraku Brachialis. You go ahead. This would be from where? From coracoid process of the scapula. Brachialis cover the brachium or the arm. Okay, and this will be the medial border of the scapula. This is actually anterior view. This is anterior view. This is posterior view here. This is posterior view. This is anterior view. This is a posterior view. Okay, so we need to know that. Very important to know the rotator cuff muscle, because especially those athletes usually got a lot of injury here. It's very famous. Rotator cuff tear, sprain, strain is very famous. Okay, and this is the Latissimus Dorsi muscle. This is lateral view showing you the acromion. You see the acromion of the scapula here, connected to the clavicle. Okay, and this is a glenoid cavity, the cave that head of humerus bind here, make your shoulders. shoulder joint. And this is show you the rotator cuff muscle will be the supraspinatus, infraspinatus, teres minor, and subscapularis anteriorly here. This is the rotator. Okay, just few just original essential deltoid muscle. The deltoid muscle looks like delta. The origin will be the acromion and the spine of the scapula and the clavicle. And the insertion will be deltoid tuberosity of the humerus. Remember when we studied the humerus, I told you there is a tuberosity here. Tuberosity wasn't put there haphazard. No, tuberosity was put there to have some kind of muscle attachment to it, called deltoid tuberosity. Same thing in the femur. When we study the femur, I told there is like gluteal tuberosity, where the gluteus muscle will be attached to this tuberosity. Okay, what the muscle action of the deltoid? Abduct, extend, and flex the arm. Abduct, as you take your arm away from your body to the side. Extend, put it back in extension, and flex the arm as well. And it's actually innervated by axillary nerve. I would like you to focus more on the muscle action, because usually there is, especially in the department final, sometimes you guys have some question about muscle action. Okay, supraspinatus, supraspinous fossa of the scapula, greater tubercle of the humerus. Humerus has two tubercle, two bony prominent, one called greater tubercle and lesser tubercle. So insertion of the supraspinatus will be the greater tubercle of the humerus. What the muscle action? Abduct the arm. Abduct the arm when you take your arm away from your body. Okay? Beautiful. Some of the forearm muscles, just I want you to know the name and to translate them into English, which is great. So like pronator teres, again, pronator, muscle that perform pronation. Brachioradialis, muscle come from the arm, go to the side of the radius here. Flexor carpi radialis, muscle that flexes your digits or your fingers, or your carpal bone, I'm sorry, your wrist or carpal bone. Palmaris longus, muscle that, palmaris from the palm of the hand, right? So palmaris longus muscle, the long muscle that reaches your palm of the hand. Pronator quadratus, this one, so perform the pronation, but its quadratus looks like quadratus here, okay, or quadratum. Okay, this is anterior muscle superficial. This is anterior muscle intermediate. You have this beautiful flexor digitorum superficialis. Again, from the name flexor digitorum, muscle that flexes your digits, and superficialis, it's still in the surface a little bit. Digitorum superficialis. Here, this is the anterior muscle, the deep anterior muscle. You have the supinator. Supinator perform the opposite of pronation here. If this perform pronation, this perform supinator, like your palm of the face of the hand facing the ceiling. Okay, when your palm of the hand facing the ceiling, this supination. And flexor digitorum profundus, again, muscle that flexes your digit, and it's really wide and big. Profundus here, see, it reaches to the digit here. And the pronator quadratus, again, pronator quadratus. Okay, same thing, you have pronator quadratus right here, and this is a pronator quadratus. That means the muscle is like quadratum, like this. Okay, this is a posterior muscle, superficial posterior of your forearm. Brachioradialis, again, coming from brachium, go to the radius. Remember, radius facing the thumb. This is your thumb. Radius always facing the thumb. Extensor carpi radialis. Extensor carpi radialis right here. See, that means it did extend your carpal bone. And longus mean long, go all the way. Okay, extensor carpi radialis brevis, That's mean extend your carpal bone and it's short. Brevis mean short. Okay. Now extensor digitorum. Extensor digitorum. Remember flexor digitorum. This extensor digitorum actually the muscle that extend your digit. Okay. Anconeus. This muscle, very short muscle, but very important muscle actually. Anconeus muscle. And the flexor carpi ulnaris, that muscle that flexes your carpal bones, and it's toward the ulna, towards the pinky. You know that the ulna is here, toward the pinky, and radius is here, towards the thumb. Extensor carpi ulnaris, see, toward the ulna, and extensor digiti minimi. You see this nice long digiti minimi, that muscle that extend the smallest digit here, the minimal one, the smallest one. Okay. Posterior muscle, deep. This is the posterior muscle in the deep. Humerus, of course. This is the ulna. You have the anconeus muscle, anconeus or anconeus. I really don't care how you pronounce it, as far as you know how to write it or what the muscle action is. Supinator. Okay. By knowing the name, supinator perform supination. Okay. Abductor pollicis longus. What that mean? Muscle. See, if you follow the muscle, this actually the muscle that abduct pollicis with the thumb. You know that the thumb is pollex. We call it pollex. So when you see pollicis, that's mean muscle perform action on the thumb. So extensor pollicis longus, muscle that extend the thumb and it's really long. See, reach all the way here. And extensor pollicis brevis, muscle that extend the thumb but it's shorter than the longus. See, this short stop here, longus reach all the way here. And extensor indicis, indices will be the index, muscle that extend the index, which actually use, as you can see, this use a lot in writing. So this is the index finger. Few original insertion. Biceps brachii, muscle with two head and the arm. Origin will be the crocoid process, short head, and tubercle above glenoid cavity of the scapula, long head. Insertion will be the radial tuberosity of the radius, of course. Action will be flexes elbow and supinate forearm and hand. Okay, let's go for Pronator Quadratus. Anterior distal end of ulna, the origin, anterior distal end of the ulna, and the insertion will be anterior distal end of the radius. Very simple, right? And it's actually from the name Pronator Quadratus, it's actually pronate forearm and hand, and actually innervated by median nerve. Okay, guys, this again, this is show you some of the bony landmark, show you the ribs, and show you the external intercostalis muscle between the ribs and internal intercostalis, and this is help with the breathing or the breathing muscle. Okay, this will be the vertebral column, this will be the aorta here, some of the bony landmark. This is the xiphoid process of the sternum. Okay, you need to do this exercise, very important. Facial expression, exercise,